everyone. My name is Lindsay DiCarlo, and I'm the Outreach and Recruitment Coordinator for the Doctor of Pharmacy program here at the University of Wisconsin Madison School of Pharmacy. Today, I'll be talking with Dr. John Dopp, Associate Professor and Vice Chair for the Pharmacy Practice Division here in the School of Pharmacy. Thanks for joining me today for a quick coffee break today. What are you having to drink?
Thanks, Lindsay. Nice to see you. I'm not a coffee drinker, so we're going with the old standby 54 milligrams of caffeine and a Diet Mountain Dew.
Yeah, I got my caffeine too to start the day, so that works. So here at this school, you have some teaching, research, and clinical responsibilities. Is that correct?
Yes.
Okay.
I do. I have 3 clinics, actually, teaching responsibilities, both in the clinic and in the classroom setting. And then I have research program that involves questions from both my clinical practice sites and my other research interests, which tend to expand out of those clinical practice sites.
So is it typical for faculty who work at a university setting to have multiple clinic sites, or is that atypical?
I would say that my clinical responsibilities are not typical. They are a little unusual, but they do work together. I'm actually fairly odd in that I'm a faculty member who has a clinic in a sleep center. And it's not odd because sleep is very medication heavy. We treat insomnia and other sleep disorders with medications, and they're complicated, and they have safety issues. So having a pharmacist's expertise to help with that is a great thing, but there's just not very many people or anyone else who does that based on the nature. I think it's because you'd have to be in an academic setting to set up a practice site like that. So I have a sleep clinic at the university. I have a sleep clinic, interestingly enough, with our athletic department to help see University of Wisconsin athletes to ensure that their sleep is as good as it can be, to help them both in the classroom and in their athletic performance, right, on the court, on the ice, on the field. And then lastly, seemingly unrelated, I have a high blood pressure clinic at the VA hospital. So I work across multiple platforms with my clinical practices, and students join me in each of those different clinics and are able to get unique exposure to those individual areas.
Okay, Jen, so can you tell me a little bit more about your responsibilities in your clinics then?
That's a great question. And what I love about my clinics is across the 3 different clinics, I do completely different things. So in my clinic at the University of Wisconsin Sleep Center, I function really as a pharmacist. I work with the physician. The physician is the main provider who the patient has the visit scheduled with. And I am there to help. I go in with the patient, but the patient is doing the visit, and I am there to act as the pharmacist to think about medication-related issues, to help with decision-making and to help select medications to treat the patient. Be aware of drug interactions, be aware of how medications we pick might worsen another medical condition, and things like that. I really function as the pharmacist, and I like that role. And then when I go to the athletic department, sleep clinic, I'm the practitioner. The appointment is scheduled with me. I conduct the patient visit, and I'm trying to investigate what's going on with the athlete's sleep and trying to develop a plan of how to improve that, right? Okay. And then I sort of transition that into high gear when I go to my high blood pressure clinic at the VA, where I, again, am the provider. And when I make a recommendation for something at my athletic department clinic, I generally make the recommendation to one of the sports medicine physicians or one of our sleep physicians to then put the order in or order the prescription or things like that. I don't have the authority to do that. Now, contrast that when I go to my high blood pressure clinic at the VA, and I am the practitioner, and in the VA system, pharmacists have prescribing authority. So within what they call my scope of practice for treating high blood pressure with the physician I work with, I can write prescriptions, I can order medications, I can order labs. All the alerts about laboratory results and patient calls and concerns come to me. And so I function individually as the practitioner at the VA because of the unique setup that the VA has. And that's really a wonderful environment for pharmacists to practice in, to be able to have that autonomy, to be able to use their knowledge of medications and disease states and put that together to do patient visits, understand what's going on, write orders, write prescriptions, and then follow up and see how that works. So it starts out in one way and it transitions across my clinics into another way. But I really like doing the different things in the different clinics. It's professionally rewarding as a pharmacist to see those different aspects.
Awesome. So I have a lot of conversations with prospective students about prescriptive authority. And I guess my question is, how common is prescriptive authority? Is that solely related to the VA, or is that common practice across the state, the country, the facility? What can you tell me a little bit about that?
Sure. I am not necessarily an expert on prescriptive authority, but as you mentioned, in the VA system, the federal system, pharmacists have prescriptive authority within their scope of practice, and that needs to be approved and defined and when you start your position. I do believe that in other parts of the federal healthcare system, that prescriptive authority can also be achieved and implemented for pharmacists, whether that's Indian Health or DoD. There's other areas I think where that can happen, although I'm not entirely sure on the details. But outside the VA, you do see pharmacists having ability to do these things under a collaborative practice agreement. And you can develop that. It's similar to the scope of practice we have in the VA, but a collaborative practice agreement is a set agreement between a pharmacist and generally a physician who oversees them. And within that collaborative practice agreement, the pharmacist can do various things, order medications, order laboratory tests, a lot of the same things that you do in their scope of practice at the VA. So that's common outside the VA, and a lot of forward-thinking health systems have that. I know UW Health in some arenas has that for some of their ambulatory pharmacists. So that's the area where it's expanding, and it's an interesting question you ask, because that is an area of pharmacy that is growing very rapidly. Positions are being added there. Pharmacist roles are expanding there into areas where they otherwise wouldn't have been, right? In fact, I was asked, and I had to say no because I already have too many clinics, about expanding into another VA clinic for sleep. And so having a fourth clinic, but I would do sleep at the VA and would have practice some prescriptive authority there, but I just couldn't handle any more clinical time right now. So it's an example of how these clinics are expanding into areas, and pharmacists are getting into specialty areas where their expertise can be used with complicated medication regimens to help the patient and to help other members of the healthcare team.
Sounds like you're doing really rewarding work, and you have a chance to explore your interests professionally, which is really exciting. But one thing that really, when you were talking about your different clinics, that sounded super interesting, because I've worked my professional career in higher education, but I've never heard of a pharmacist working in the athletic department. I just never thought about it. I know that they have healthcare professionals that work with them in case if there's injuries and PT and everything, but a pharmacist, I thought, well, okay, so you're going to give the meds that needed to. But I thought they went to the University Health Services department, which is the local clinic on campus. So anyways, can you tell me a little bit more about the role that you have? Because I think that's pretty unique, right?
Yeah, it's pretty unique. It's kind of an odd duck situation, but in a good way. For me, I find it very rewarding, and our students who get to come rotate through with me in that clinic and do some interesting things that they would never otherwise get an opportunity to do. So that opportunity arose out of research I was doing, we were looking at risk of sleep disorders in athletes, particularly some of the higher risk groups like our offensive linemen on the football team and wrestlers and things like that. And so then one of the associate athletic directors felt like this interest in sleep and this focus on sleep was really a beneficial thing. He wanted to expand it to look at making sure that the sleep of all athletes was as good as it could be. And at that point, I had worked with sleep physicians over at the Sleep Center for 15 years, had a lot of clinical experience seeing patients. And it was more of a, hey, we're just going to look at this from an improving sleep in a general sense. We're going to take that approach. And then we're going to use the infrastructure there to implement the changes that we need to do when we make an order for a patient or we want to write a prescription. So like I said before, it kind of falls in between my responsibilities where I have some autonomy, but I work with the sleep physicians and then the sports medicine physicians to do what I want to do. So generally, the most frequent thing we see there is athletes who have insomnia of some kind, right? So if you think about the stress on an average undergraduate college student, it's high. And then you add in a compressed schedule, a training regimen, travel, competition, and all those factors that athletes have to deal with. And they their stress levels can be higher and their schedules compressed. So a lot of times they're dealing with stress or low-grade anxiety that gives them manifests as insomnia, difficulty initiating sleep, difficulty maintaining sleep. They wake up in the middle of the night. And when that happens, it disrupts their training, it slows them down, it negatively affects their athletic performance, they're falling asleep in class. You know, at this university, our athletes really have to go to class and do well in their classwork. It's something that they take very seriously and are very proud of here. So, you know, that's just as important as their performance on the athletic field. But I don't do so much recommending prescription of sleeping medications there. It's a lot of sleep behaviors, sleep hygiene, moving around other medications that they might be taking, adjusting those medications, implementing cognitive behavioral intervention, stimulus control, working with some of the psychologists in the athletic department, and then the primary care physicians in sports medicine to say, okay, this patient maybe does need to use something to help them sleep. Let's use low dose trazodone or something that the sports medicine physician's comfortable with. Or a lot of times what I also see is people who have their body clock shifted and they want to go to bed late and wake up late. Well, when they have to be in the pool at 5:30, that's a problem. So we need to use melatonin to help shift their body clock earlier so they can go to bed at 9:30, 10 o'clock and be able to wake up to be in the pool and use melatonin to shift their body clock. And that's something that's interesting. There was an interesting opportunity where we did something like that with a couple of our PharmD students a few years ago. PharmD students that were on rotation with me helped design a schedule using bright light exposure and on the other end of the trip using melatonin to shift the body clocks of the men's basketball team when they went on a trip to Maui for a invitational around Thanksgiving. And that's a 4-hour time differential, maybe even a 5 at that time of year. And they wanted their body clocks to be rapidly shifted so it wasn't a competitive disadvantage of them. So the student helped me come up with a light exposure plan. We had the athletics department buy some bright blue lights to use for their exposure in the evening. And the student thought that was just about the most interesting thing they'd ever done. And it was fairly unique. And then like the next year they went on a summer trip to Australia and New Zealand. And a different student helped me develop a plan to shift the athletes' body clocks. And that's quite a shift because it's basically 19 hours ahead of us. So it was light exposure and use of low-dose melatonin to help them shift their body clocks. So they were adjusted and they weren't, they didn't feel like they were playing a game in the middle of the night in central time zone here. So those are some unique opportunities that students took with me that are atypical for a pharmacist. But it was just happened to be some connections I had, and my years of being in sleep medicine clinics prepared me to be able to go ahead and do that independently. And I do still work with the sleep physicians. A lot of times I'll check in with them, send them copies of my notes. I operate pretty closely with them so that we're consistent with what we would do at the sleep clinic.
Oh, that's really fascinating. Thank you for sharing that with me. One question I had is, if a student who's listening to this and they're thinking, hey, that sounds really fascinating, and they're really inspired and maybe want to do something similar like that. You're merging a couple of different worlds. You're merging biology, biological systems with athletics. And I think that could definitely attract some students. If someone's interested in doing something like that, then is UW a place that they could explore that career path?
Yes. I mean, if let's say you were at the nexus of athletic performance and sleep, there are places around the country where that's being researched, but as far as I know, this is the only pharmacy school where you could use your knowledge of medications to help with athletic performance and sleep and those things of that nature. My blood pressure clinic is unique in the sense that it's all patients who have very difficult to control high blood pressure or have kidney disease and high blood pressure. And there's rotation sites like that around the country at various pharmacy schools. But the approach that we take with it, with our nephrologist there, is fairly unique. And then my sleep and athletics and sleep at the UW Center is a great place to be exposed to find out if that's really something that you like and you want to take forward. I think I'm the only academic pharmacy person in the country, maybe the world, that is doing sleep. And so this is a really unique situation to UW-Madison. Not necessarily to me, I'm just the pharmacist that's there, but it's because the system allows it, and it's a great opportunity for our students to take advantage. So if potential students are interested, there's various, and I'm just one of many faculty members here who has similarly unique opportunities. into, besides the typical clinical rotation sites and opportunities that students can have, there's a lot of very unique clinical sites where students can come if they're interested to get experience and to get on a trajectory to explore that further in their professional career.
Well, really neat. So that sounds like a really good opportunity for students to study under you, to be mentored by you, and other professionals that are doing that similar work here. So sounds like a good opportunity, everybody.
Yeah, I mean, I think we're a major research institution, but besides that, we have a really great system in that our other health professional schools are really well integrated here.
Yeah.
And you have a medical school, you have a physical therapy program, you have a athletic training program, you have nursing, you have occupational therapy, you have all these health professionals integrated in one campus. And particularly, almost all of us are on West Campus. And an integrated academic medical center is a great place where if you weren't as integrated from a structural and from a location standpoint, I don't think you realize what you lose in terms of the opportunities for people to collaborate and use their professional expertise to help take care of patients, to be involved in designing good research, and to answer good clinical questions. So besides the fact that we're a massive research institution, we also have a great structure that allows students to work and take advantage of the various disciplines here. But I don't want anyone to feel like this is really a massive place and you get lost. We work a lot in one-on-one. We work in small groups. When the students work with me, it's a one-on-one. And I say we're massive in the sense that you have a whole host of opportunities, not that you're going to be fending for yourself and drowning in a pool of hundreds.
Before we go, I do want to take an opportunity to explore a little bit more about the interprofessional learning opportunities, because I think that's a really big plus of our school. It's one of the things that I think is a main selling point for our program. Can you expand at all about those opportunities that students would be afforded by coming to our program?
Yeah, so I touched on it. So clearly it's something that I feel we do really well here. And to expand upon it further, I'd say that not only do we have all of the integrated parts of the health science campus where you'll be working with nursing students, medical students, PT students, OT students, even veterinary students, you're going to be put into disciplines where the discipline itself is really interprofessional. And I'll use sleep as a great example of that, right? So some places will say, oh, we're interdisciplinary or interprofessional because we have nursing, pharmacy, and medicine. And something like sleep, not only are you interprofessional in that sense, you're interprofessional in the sense that even within medicine, there's 5 or 6 different specialties there, right? So at our sleep center, there's psychiatry, there's neurology, there's pulmonology, there's internal medicine, and there's geriatrics, there's pediatrics, there's respiratory therapists, right? Which are outside of medicine, but are intrinsic to that. And so even within medicine or within specialties, you have subspecialties that bring extremely different perspectives, right? So in my sleep clinic, I work with a neurologist, but I also work and answer questions from the pulmonologist and from the geriatrician and from the psychiatrist. And not only do I help them, but I learn a ton from them in return, and our students benefit from that. At the athletic department, I'm working with the sports medicine, internal medicine physicians. I'm working with the athletic trainers. How many pharmacy students are working with athletic trainers talking about the effects of ADHD medications or sleep medications on whether or not someone's NCAA drug test is going to come up positive, right? So there's all kinds of different aspects that interprofessionally we do well here. And I think the School of Pharmacy has been a real leader in interprofessional, somewhat because as pharmacists in the past, we've always been trying to prove ourselves. So we've been seeking out collaborations with different areas to show what we can do and to help patients. And I think over the past 15 to 20 years, that work has really paid off in the sense that we've established great collaborations in areas where our faculty members and the pharmacists in this system are able to do great things, but that our students have an amazing experience in areas they wouldn't have otherwise had the chance to see outside this campus.
So to wrap up then, you talked a lot about how the profession works or how pharmacists work interprofessionally. I think that's going to be a really great way to prepare students for entering the workforce. So that leads me to the last question about the workforce, the future of the workforce. How do you think that the field of pharmacy, the roles, responsibilities, the job opportunities in pharmacy are going to change in the future, next 5-10 years, or just in the future in general?
Yeah, pharmacy is evolving. I mean, everything changes, but pharmacy really is evolving. And if you only read the headlines and don't dig beneath the surface, you might see that some of the traditional pharmacy jobs the job market isn't as good as it once was. And that's true. But if you dig beneath that and look at where the profession is expanding, I see tremendous growth, and particularly in the areas that I talked about in ambulatory care, where pharmacists are operating under collaborative practice agreements and under scopes of practice. Those aspects of the profession are really growing and allowing pharmacists to use their knowledge and their expertise about medications to help patients in the best way. But beyond ambulatory care, there are other aspects of the profession that are expanding as well. In community pharmacy, opportunities are expanding in areas where we wouldn't have thought so before. Acute care, inpatient pharmacy, specialty pharmacy is a huge area where pharmacy's expertise is growing and growing. And I mean, you cannot turn on the TV without seeing an ad for a medication that probably comes from a specialty pharmacy, either for psoriasis or for arthritis. It's one of these injectable or oral specialty medications that it's essential that pharmacists have the knowledge of. So there are really key areas of the profession that are expanding. Rural health is another area where pharmacy jobs are plentiful. And we have a rural health program that we've started, and we connect students with pharmacists in rural health programs in Wisconsin, so they gain the experience and the expertise to be able to hit the ground running when they graduate. Not only that, they've met people in the communities where they have a connection to get a job or to work with a different health system to implement what they learned from their experiences. So we are trying to take our program and do an analysis of, okay, where are the jobs and how can we train our students to best be prepared and be connected with those settings to give them a leg up for those career options should they want to do that.
Oh, fantastic. And I think you gave me a really good idea for a future coffee chat. Maybe I'll pull a couple of you and just expand on, just focus on future careers and the expansion of pharmacy. So thanks for that idea.
Yeah, you might want to double the time slot for that then.
Okay, we'll do that. Well, thank you for having coffee with me today.
You're welcome. It was a pleasure, Lindsay.
It was a pleasure. Take care. Have a great day.
Yep. Thanks, everyone. Bye-bye.
Bye.